Okay, I didn't wear them today. I apologize. But these are just as good. Good morning. Thank you so much for having me. It's a pleasure to be here and to take the stage with so many wonderful women. My talk here today is Learning to Lead Like a Lady in a Man's World, Lessons I've Learned as I've made the upward rise in my own career path. And I want to tell you that I'm actually fortunate enough to be one of those women who met one of those men. I was stuck in a job at University of Maryland for 17 years, battling around the negative rejections and, oh, I'm not going to support you to be a board examiner at the American Board of Anesthesia. I'm not going to support you into the Association of University Anesthesiologists. Oh, I'm not going to support you to be a full professor. And when you hit those doors, you come up with really creative ways to open them. I found out I needed chair letters, so I actually went to other chairs who were willing to support and write. And guess what? It was really surprising to my chair when he found out, oh, you're now a member of this? How did you get that? Well, I got a letter. Who supported you? Well, I can't release that. It's personal. So anyhow, I am a board examiner for the American Board of Anesthesia, much to his chagrin. I have been doing that for 6 years, and I have promoted so many other women to be up there. I am on the AUA, much to his surprise also, which is a research organization. Did not support me for that. And I actually left University of Maryland to go to Rochester because of the shine theory. The fact is, what I did made him look good, and that's why he took me. So I have no relevant financial disclosures for this talk. I am on the AMWA Board of Directors, and I am co-chair of the Gender Equity Task Force. And I wish I could tell you that so much has changed in the last year since I gave my last Taking a Stance talk here, and that efforts have been underway to increase diversity and inclusion. This is the latest AAMC data from spring of 2019. On the left, you're going to see the number of chairwomen, and on the right, the deans. The top lines refer to the men, which is, as you see, declining slightly. And on the bottom is the women, also increasing slightly. But as you can see, still huge gaps. So when we think about leadership, and particularly leaders, the images that we think of and see are those of the stereotypical good-looking white man. Thank you, John Hamm. They're in their button-down collar shirts, their power ties and suits, and their attaché cases. And as much as we want to think of ourselves as unbiased and objective, we really aren't. But the path to get there for men seems to be so much easier. They're walking up stairs of money. While for women, it's more of this arduous climb. And it's difficult for us because we now have to conform to all the rules that the men have created. And those are the rules that we have to pass for promotion and advancement. What I'm talking about is that three-legged stool. As you can see on the left, there are angles, there are measurements, and you have to meet every single one of them. Versus the woman on the right, if you can tell, is only sitting on 2 legs. What I'm talking about is engaging in research and publishing that correct number of papers. And it's hard to do that when you're taking time off for maternity leave, for pregnancy, for kids' sickness, for parents' health, for anything that comes up that you have to take care of. It's hard to get those grants in the first place because no one wants to support you. You also have to engage in clinical practice and patient care, and your evaluations from residents and trainees matter. And as we all know, the way we are graded is different than the way the men are graded. We have to be compassionate and nurturing and very supportive, while they just have to be educating, teaching. You get the picture. So in some places, there's even this administrative leg, which is even harder to handle. At Maryland, to become an associate professor, I had to be in administrative roles. And that meant that your chair needed to take a chance with you because you've had no other previous administrative experience or leadership roles. So I luckily had walked into University of Maryland with a female chair. Who knew? And she basically immediately promoted me to a division chief for cardiac anesthesia and also the fellowship director, a position I held for 17 years before I left. So I'm standing here today because I, like so many of the women in your midst this weekend at this conference, have successfully navigated this academic career. I serve as the vice chair of anesthesia and perioperative medicine at the University of Rochester, and I'm also the chief of cardiac anesthesia as appointed by the cardiac surgeons at Rochester, and I'm director of the simulation program. I'm also a happily married mother of 2, and I want to give you some tips on how you can be successful. So, as a woman, you are taught to please. And many of those qualities, as we climb to the ladder of success, are really not sustaining at the top. We enroll in leadership development courses, but they teach you how to negotiate and to network and to really speak like a man. It kind of implies that there's something wrong with the way you are and the way that you lead. The ability to empathize and to build strong relationships with those around us is really a strength, as are many of the other traits that you see here. You know, Dr. Seuss said it right. Resist the temptation to fit in. You were born to stand out. Women possess so many of the skill sets that good leaders need to have in terms of communication skills and compassion, being engaging, and fostering really a team approach to problem solving. These are things that come naturally to us and to other women, but unfortunately not really for the guys. Recently, I'm going to say about 3 to 6 months ago, I was asked to present at this new virtual grand round to the American College of Surgeons. And this is something that is reaching out to about 46 centers, 19 time zones, and I am, as I said, not a surgeon currently. I originally trained as a surgeon and then switched to anesthesia. But they wanted me to talk because I've successfully navigated a system and come up with a creative way to bring multidisciplinary teams together in 2 institutions, and this is something that none of them have been able to figure out how to do. Honestly, I'm kind of sweating this one out because I can't figure out how to put into words something that is so obvious to me. And I'm supposed to talk for an hour on this. Develop your executive presence. It's not a measure of your academic degrees or your accolades, but really how you show up, how you are perceived, how you have your stage presence, and according to those in senior leadership, it's your force and your impact, your gravitas. As Margaret Thatcher said, be that powerful one in the room, the one that commands respect the minute you walk in, and people look to for guidance and advice. Find your voice. Don't be afraid to speak up. And I'm not saying to dominate conversations or even be louder than everyone else, because sometimes having a softer tone is really just what you need. Find ways to add value. Don't be afraid to communicate your career aspirations. If you don't say something, they don't know, and they don't assume. Men are often promoted because they're asking for promotion. They're asking for more responsibility, and for some reason, women don't do that. You really need to. Be yourself. Be a spokeswoman for those junior faculty around you. Help them to fight their battles. Recently, a couple stories. There was an issue at work with no place for one of my junior female cardiac anesthesiologists who just returned from maternity leave to pump. And she was trying to figure out how to do a cardiac case, pump for her son, and come back. She's nowhere in the operating room. So basically, she told me about her problems. I said, oh, I got this. So I approached the OR director, and I stated, hey, we have a need for this. He's like, I don't think so. Really? Okay. So then I decided to remind him of the current ACGME wellness initiatives and remind him of the University of Rochester's emphasis on diversity and remind him of a few other existing policies that would really be beneficial for his career interests. And suddenly, his desire to comply became really evident. So we were able to transform in a really short amount of time an old nursing office into a really beautiful lactation room. And it had a designated swipe card, and we have a couch and a desk and a chair and a computer and a phone and even a fridge. Who knew? And it's available not only for my junior female faculty members, but also residents, trainees, and other subspecialties in surgery, and anyone else in the OR on the professional side who needs it. But not all struggles have been easy. And I think it requires you to do a lot of, and I'm going to turn this, education. And I recently interceded on behalf of another one of my pregnant cardiac attendings. Notice the pattern there. I've noticed that I've come into institutions as a division chief for cardiac. Suddenly it's like a magnet, and these women are coming out of the woodwork from all over the country and suddenly want to be somewhere. Cardiac anesthesia is still a predominantly male field, and we're working on a daily basis with cardiac surgeons. So this unfortunate cardiac attending had just returned from a vacation, and she decided to check in to see what cases she was doing the next day. And unfortunately, much to her surprise, she realized she was scheduled in a fluoro room. So she appropriately picked up the phone, called the clinical director of the OR. The normal one was out on vacation, and she said, "Hey, is there any way I can be reposted? This posting isn't going to work." Rather than ask any questions, the male clinical director said, "Oh, I've got this. No worries." The next morning I come in and I find her in tears in the locker room. Turns out the clinical director took her from the fluoro room and put her in a CT, CAT scan room. Okay. I'm thinking, that's interesting. I said, "Don't worry about this. I've got this." So I went out to the clinical director. I said, "Hey, what were you thinking? Do you think if a young woman of childbearing age comes to you and requests a posting change, there's probably a reason? Do you think you can figure out what that could be? Left brain?" I said, "I realize OB was a long time for you, but maybe you could understand that a pregnant woman wouldn't want to be exposed to radiation. If that was your wife, your mother, your daughter, anyone, do you feel comfortable putting them in that room?" Well, she didn't argue, he says. I said, let's take a seat for a minute. Do you want a cup of coffee? He's like, "What?" And I said, "I think we have to explain something. You know, she's new here. She doesn't want to create waves. She doesn't want to be known as a troublemaker. And she doesn't want a reputation. So what do you think you should do now, after you apologize to her?" So basically, in a short time, she was pulled from that room and put somewhere else. Imagine my surprise when suddenly at the executive committee meeting the next week, my ruckus in the OR was brought to everyone's attention. So suddenly I was presenting among all my male peers at the executive committee meeting, of which I am a member, the only female, I might add. But anyhow, I was asked to explain, do we need a new policy? Yeah, I think so. Let me tell you why. Because as we keep attracting more diverse talent, especially in cardiac anesthesia and everywhere else, which we want, you're going to have to make some concessions, and you're going to have to understand why. And you don't get to ask why someone doesn't want to publicly acknowledge the fact that they're pregnant in 12 weeks. Just the way it goes. So, anyhow, I realize that some of these battles will be difficult. I realize they can be frustrating at times, but it's our job as women and as senior women to educate and become eternal educators for men in our field. Focus on your actions. Basically, Don't worry what other people are saying about you or what they're thinking about you. Doesn't really matter. Do the right thing. We have a choice about the actions that you take and the attitudes that you you hold. Voice your opinions and stay firm in your convictions. Build a circle of support. Utilize all those resources around you. Seek guidance and help. And make time to invest in relationships outside of work. Those truly are what you need to break and get away from work sometimes. And elicit feedback. University of Rochester has an interesting motto known as the Meliora approach. Really is always striving to do better. And I think a lot of people there do live by this. And be a role model. Advocate for others. Create opportunities for those less fortunate. When I got to Rochester, I actually started a shadowing, mentoring program for underprivileged women. There's a school called YWCP. It's a Young Women's College Prep. It's sitting in Greece, New York. I had done some work with the AMA regarding going out to charter schools. And I created a shadow program for them to come spend a week in a perioperative environment. And basically, they could explore careers in medicine and surgery and all perioperative help. This has actually grown in the last year. It's not just about that rotation. It's about teaching them how to be professionals in a career world, learning how to write cover letters, how to dress, how to act, and how to respond. Share your story, become this mentor, be a spokeswoman for the younger generation, and advocate in meaningful ways. And basically, you're going to make mistakes along the way. No one's perfect. Learn from that, move on, and just do it.
Thank you, Dr. Bernstein. We have time for 2 questions, 1 question. Yes, go ahead.
I just wanted to say, I'm Susie Figofsky. I'm a cardiac electrophysiologist, so another field where it's 6% women.
Yeah.
And the theme that I've heard all morning that I just want to emphasize is that someone else's no doesn't have to be your no. It's their no. And you just keep going and you keep fighting and you find a way to do what you do. And I wanted to emphasize something that you said about taking a chance and applying and asking. I am not in academics, and I've always felt that I wasn't good enough because I wasn't a teacher, and that I didn't have anything to contribute to a cardiac community. And I have just started applying for things, and to my surprise, I am now a member of the American College of Cardiology Women in Cardiology Leadership Council. I am a member of the Communications Committee for the Heart Rhythm Society, and I was just elected to the American Board of Internal Medicine Cardiovascular Governing Board.
Sounds great.
And I was in a job for 10 years where I was told that I was worthless. And so you all can find your worth and go with it. So thank you. I really loved your lecture. Thank you.
Thank you. Thank you, Dr. Bernstein.